If Measure H had passed, would having more beds have helped alleviate some of the challenges we are facing?
Had Measure H passed, which is hard to believe, that was 8 years ago. It was in April 2016 that we went to the community and asked them to pass Measure H, which was a $327 million general obligation bond. The project cost was about $550 million at that time. Now has grown to $750 million with inflation. And so that $750 million project would replace all 206 of the current beds in the Mineral King Wing, as well as add 34 additional beds. So the plan would be to build 240 beds to accommodate future growth. The thing is, there's so, again, medicine is so quickly evolving. So it wasn't that long ago, if you needed a hip replacement or a knee replacement, you'd come to Kaweah, you'd have your surgery, you'd probably spend 2-3 days, maybe in the Broderick Pavilion, and you'd be discharged. Now you go to Kaweah Surgery Center out on Acres, you have it done, and you go home that same day. You're having it done in an outpatient, they're doing full hip replacements and knee replacements, same day surgery, and you're going home. You're seeing more and more services move out of the acute inpatient hospital into ambulatory settings. We are exploring a program called Hospital at Home. We bring out a hospital bed to their home, all the monitors, and they would be an admitted patient. They would, if we had one, they would be admitted at Kaweah, but they're being cared for in their own home. And we would have nurses going to them every day, physicians, a lot of it through telehealth. So we are exploring that to potentially take pressure off the downtown acute care hospital. Expanding skilled nursing. It's interesting, it's now come full circle that hospitals are now buying back skilled nursing facilities that they sold or got out of because it was so unprofitable, they couldn't afford to continue to subsidize it. The rules have kind of changed a bit, but hospitals are now seeing skilled nursing facilities that they control as a major release valve to be able to move patients out of the acute care setting faster. They're not ready to go home yet, but we can take care of them just as well in a skilled nursing bed as in an acute care bed. So while we're looking to build more beds, at the same time we're also working to reduce the demand of acute inpatient beds. So that's why it makes it hard to really predict, you know, how many actual physical beds are we going to need in the future. I mean, genetic, you know, medicine, that curing diseases, we're now all the GLP-1s and gastric bypass going away and reducing heart disease and all of the health benefits of that. How is that going to impact healthcare and medicine down the road?